My name is Haile Jesus Getaun, and I'm the Director of the Global Coordination and Partnership on Antimicrobial Resistance Department at the World Health Organization. I'm also the Director of the Quadripartite Joint Secretariat on Antimicrobial Resistance. The quadripartite include the World Health Organization, the United Nations Food and Agriculture Organization FAO, the World Organization for Animal Health OIE, and the UN Environment Programme. In this presentation, I will highlight on the importance of multidisciplinary research on antimicrobial resistance through a One Health approach and the role of the quadripartite organizations. Antimicrobials, including antibiotics, antivirals, antifungals, and antiparasitics, are medicines used to prevent and treat infections in humans, animals, and plants. Their use is shared among humans, animals, and plants. Antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread, severe illness, and death. Antimicrobial resistance organisms are found in people, animals, and the environment. They can spread from person to person or between people and animals, including from food of animal origin. This is why the response to antimicrobial resistance should be guided by a One Health approach that aims to sustainably balance and optimize the health of people, animals, and ecosystem. The main drivers of antimicrobial resistance include the misuse and overuse of antimicrobials, lack of access to clean water, sanitation and hygiene for both humans and animals, poor infection and disease prevention and control in healthcare facilities and farms, poor access to quality, affordable medicines, vaccines and diagnostics, and lack of awareness and knowledge, and lack of enforcement of legislation both in human, animal, and the food sectors. The Quadripartite Joint Secretariat on Antimicrobial Resistance coordinates the multisectoral AMR response. It consolidates cooperation between FAO, OIE, UNEP, and WHO, drawing on their core mandate and comparative advantage to address the One Health response against AMR. The Secretariat has a vast range of functions, including defining the research agenda for AMR in a One Health context across all sectors, which is the focus of my presentation today. Defining the One Health research agenda for AMR is one important ongoing activity of this quadripartite secretariat, which is expected to be completed by the end of 2022 and launched in early 2023. This is a global participatory process that starts with the definition of scope and identification of key areas, which was followed by mapping of the research questions and gaps which are already known through a scoping review. The research priorities will be presented in 5 key areas as presented on this slide: transmission, behavioral insight and change, interventions, economics, and integrated surveillance. In conclusion, AMR is a complex problem that requires a united and coordinated multisectoral approach, including by researchers. Multidisciplinary research to address the gaps across the One Health spectrum are critical to attain better public health outcomes for AMR. Stay tuned for the One Health research priorities of AMR, and please contact the Quadripartite Joint Secretariat if you have any questions or need more information. Thank you very much.